Nursing process.
Introduction.
The nursing process is an evidence-based, 5-step scientific method used to ensure that the patient is assessed, diagnosed and receives continuity of care across appropriate healthcare providers and departments. Nursing process is made up of 2 words. Nursing is a dynamic, therapeutic, and educative process in meeting the health needs of the individual, family and society. Process is a systematic way of doing things. It includes series of actions. History, development of nursing process. Lydia Hall, 1955, introduced the term nursing process. Lydia identified 3 aspects of nursing care, cure and core, and the 3 steps of nursing process: observation, ministration of care and validation. Nursing practice was first described as a 4-stage nursing process by Ida Jean Orlando in 1958. The diagnosis phase was added later. In 1959, Dorothy Johnson described nursing as fostering the behavioral functioning of the client. She further explained that there are 3 steps of nursing process: assessment, decision, and nursing action. In 1961, Ida Orlando explained a 3-step nursing process: client's behavior, nurse's reaction, and nurse's actions. In 1963, Lois Knowles given a 5-step nursing process using the 5 Ds: discover, delve, decide, do, and discriminate. The discover and delve steps are relates to assessment phase. Decide is the planning stage, do is the implementation stage, discriminate is the evaluation phase of client responses to nursing interventions. Definition. It is defined as a systematic problem-solving approach for giving comprehensive nursing care. Nursing process can be defined as an orderly, systematic way of identifying the client's problems, making plans to solve them, initiating the plans or assigning others to implement it, and evaluating the extent to which the plan was effective in resolving the problems identified. Purposes of nursing process. Primary purpose of nursing process is to help the nurse to manage each patient's nursing care intelligently, scientifically, and judiciously. Other purposes are: to help the patient in maintaining health, to protect client from illness, to identify client's health status, to identify client's actual and potential health problems, to determine priorities, to establish plan for meeting the identified needs, to deliver the specific nursing interventions, to evaluate effectiveness of care provided, to promote recovery from illness, to promote return to a state of maximum functioning. During terminal illness, to help the client have a peaceful death. Characteristics of nursing process: problem-oriented, goal-oriented, universally applicable, cyclic and dynamic, interpersonal and collaborative, involves creativity in designing ways, open and flexible, client-oriented and individualized approach, systematic and planned, emphasis on feedback. Problem-oriented. Nursing process is always focusing on client's problems. Problem may be actual/current or potential problem. Actual problems means the need/problem from which client is already suffering. E.g. loss of appetite, did not sleep in whole night, constipation, pain, vomiting, loss of consciousness, dyspnea, breathing difficulty. Potential problem means problem which are not presently, client have, but in future, there are chances/probability for their occurrence. E.g. in case client is bedridden or obese, patient may develop bed sore, muscle wastage, constipation, etc. Universally applicable. It means information collected in one setting will be understood similarly in other setting, city, worldwide. In nursing process we are following standardized steps as well as NANDA diagnosis, regardless of location worldwide, same terminology will be applied. This avoids duplication and avoids omission of information. Dynamic. It is a dynamic activity that begins when the nurse collects subjective data and objective data. Dynamic means changeable. The database grows as nurse uses nursing process. New data is added if the patient's condition changes or patient reveals more information. Cyclic. Nursing process involves interrelated steps. Nurse can't process by omitting one step. Just like a wheel, the nursing process continuously proceeds until the problem is solved or goal is achieved. Interpersonal and collaborative approach. In the assessment phase of nursing process, she verifies/collects information from laboratory investigation as well as medical records. Similarly, in the planning phase, also she consults the doctor, physiotherapist, and dietitian in solving the client's problem. In this way, nursing process follows interpersonal and collaborative approach. Creativity. Nursing process involves creativity in designing ways. In the every step of nursing process, nurse follows critical thinking to assess/identify the client's problem. She develops the rapport with client and acquire information. Goal-oriented. Nursing process is always goal-oriented. While approaching the client, nurse keeps in mind her professional goal, i.e., to promote health, prevent the occurrence of disease, protect client from complications, to enhance early recovery from disease condition. Open and flexible. The phases of nursing process are open and flexible. It means that at any point of time the care plan can be revised based on the current needs and priorities of the client. Client-oriented. Every step of nursing process involves client's problem. Client's problem may vary from time to time, age to age, religion to religion, place to place. Nurse always identifies and solve the problem of client by keeping in mind client's age, gender, personal interest, values, feelings, etc. Systematic and planned. Nursing process always follows series of action steps. Nurse can't proceed to third step until she followed first two steps in sequence. Nursing process is always a planned activity, before interacting with client. She keeps in mind the whole plan to gather and resolve efficient problem. For this, nurse needs to have up-to-date knowledge. Feedback. Nursing process gives much weightage to the feedback, i.e. client's reaction to the identified/potential problem. If the feedback is positive, means problem is solved. It gives satisfaction to the nurse for her activities. If the feedback is negative, she again follows the nursing steps to resolve the problem. Nursing steps are interrelated. Every step of nursing process is closely related. Each step is dependent on other step. E.g., nurse can't frame nursing diagnosis until the assessment step is completed. From the figure it is clearly seen that these steps are slightly overlapped also.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.